Welcome back. Think of it as a high-tech house call. You don't have to visit a doctor's office anymore thanks to telemedicine. David Milich is the CEO of UnitedHealthcare of Texas, here to talk about how we can all see a doctor through an app on our smartphones. That sounds pretty easy to me. Good morning to you.
Yeah, you know, when I was here last time, we were talking about open enrollment. And one of the things we talked about were some of the new things that are being made available through employee benefit plans, and virtual medicine or telehealth is certainly one of the things that has really taken off in the last year and a half.
If you just think about it for a second, let's say you have the flu or bronchitis, whatever it is, and you're lying in bed, the last thing you want to do is go get in your car and get to the doctor to get a prescription for help.
Absolutely.
You can do that through your phone now.
Yeah, through your phone, through your iPad. You know, it can be telephonic, it can be through video, you know, FaceTiming, and it's definitely something that our customers, our consumers are utilizing more and more. Satisfaction rates are incredibly high, and also in terms of addressing the problem that the patient is calling for, about 74% of the time it's a single visit. You have access to a prescription. It's very, very cool, and very the technology's evolved to where it's much easier than it has been.
Well, and I'm impressed to see that 9 out of 10 employers are now providing this to their employees. So it's easy to get access to this. Now, what about if you don't have medical or health insurance? Is it going to be affordable?
I mean, you can, you know, many providers here in Houston have their own telemedicine service, so you can access be it Kelsey-Seybold or other local primary care groups have offer the service as well. So you know, the visit can be, you know, $50, $60. So yeah, it's much more affordable certainly than inappropriately utilizing an urgent care, or I'm sorry, a emergency room.
Right, which people do. They do all the time just for convenience sake if their doctor can't get them in. Okay, so you brought in.
I brought in my iPad.
Pretend this is your iPhone, so or your
this is
cell
actually
phone.
So what this is this is actually the UnitedHealthcare member portal or website. Okay, my UHC, Health for Me, and so you come. This is the dashboard. You go to virtual visits. If this is the first time, it'll sort of give you an idea of what maybe some of the symptoms that you may be experiencing, and would this be appropriate. You can put in your medical information if you haven't already. I've already done that, so I'm going to request a visit. And then it brings up me. I also have my family members loaded in here. I click on me. Where am I? So it's got a GPS tracker on here, so it says it knows where I'm at. So if I'm on vacation or my child is away at school.
Would that change the doctor that you talk to?
It may not necessarily. It could, because you have the ability to pick a specific doctor or just choose anyone who's available. But it certainly always brings up somebody who's within the program.
What is typically the wait time? If you schedule 15 minutes out or hours out or days in advance?
It's usually about 10 to 15 minutes. You can schedule it. So, for example, if you're at work and you want to schedule it over your lunch break, you can actually put in a scheduled time.
And this is also becoming very popular with behavioral health as well, right? Not just a cough or a fever.
When we look at our customers' utilization, so our employers' utilization here in Houston and across Texas, the fastest growing reason why people are leveraging virtual health is for behavioral health issues.
Wow, that's
and it's great, because what it does is it gives access points that you may not otherwise have.
And look at all these other things. If you're having stomach pain, if you have any kind of allergy, blood pressure problems, a type of ear infection, headaches, respiratory infections. I mean, all of these different things, you can get help and never have to leave your home or office.
And like I said, the app is very easy to use. It takes you through, you know, why are you calling? As I said, do you want to schedule with somebody in particular? If I went a couple of steps further and I hit send, within 10 minutes, I would have a FaceTime via my iPad here, and I could do a visit in the green room.
I'll tell you, an apple a day, I'll keep them away so eat more. No, I'm kidding. Thanks so much for coming in.
My pleasure.
Morning.
Thank you. Always great to see you.
Glad you walked us through it. All right, let's